Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, everyone. First, I want to thank the participants who attend this meeting. Before we start our presentation, introduce my name is Amanda Kiani Rahmaraya from Senior High School 1 Tuban, and here I'm going to be the host. Today, we will have a presentation from Team 2 of Tuban 1 Senior High School with the topic is, What is Phobia? Which will be delivered by Lintang Muhammad Ilyasa, Aliya Thaharah, and Firza Brilliant Princessa as the presenter. Then there is Luluul Maknun as the moderator for this meeting. Before that, I would like to tell you a little information that the presentation on this topic will be in English. So we don't hold any session with using Bahasa. Okay, so without further ado, let's get start our presentation. For Uul as moderator, I welcome you.
Okay, thank you, Amanda, for your time. Well, before starting the presentation, I will read a little of our presenters' biodata. First one is Aliya Thaharah. She was born in Tuban, 22nd of March, 2004. The second one is Lintang Muhammad Ilyasa. He was born in Tuban, 2nd of August, 2003. And Firza Brilliant Princessa. She was born in Tuban, 2nd of August, 2003. And they are all currently enrolled as students in Senior High School in Tuban. All right, to save the time, I kindly invite Aliya, Lintang, and Firza to deliver the presentation.
Okay, thank you. I will share the screen. Okay.
Okay, thank you, Uul and Amanda. Okay, here today we're from Group 2. We're going to explain a little bit about the phobia and anything related to phobia. But before that, let me ask you a question. Do you ever fear of something, or is just a fear, or it's a phobia? Wait, do you even know what is phobia actually mean is? Don't worry, because we're going to cover some of that and we're going to explain a little bit about phobia. Okay, let's get into the material. Next. Before that, let us introduce ourselves. First, my name is Aliya Thaharah. I was born in Tuban, January 22nd, 2004, and we're from SMA 1 Tuban. And next is my friend.
I'm Lintang Muhammad Ilyasa, born in Tuban, 2nd August 2003. Here's my email, lintangmuhammad9@gmail.com, and I'm from SMAN 1 Tuban too.
I'm Firza Brilliant Princessa. I was born in August 2nd of 2003. And here's my email. You can contact me there. And I'm from SMAN 1 Tuban.
Okay, next. First, we're going to explain is what are phobias. A phobia is an excessive and irrational fear reaction. If you have a phobia, you may experience a deep sense of dread or panic when you encounter the source of your fear. The fear can be a certain place, situation, or object. Unlike general anxiety disorders, a phobia is usually connected to something specific. The impact of a phobia can range from annoying to severely disabling, and an estimated 19 million Americans have a phobia that causes difficulty in some area of their lives. People with phobias often realize their fear is irrational, but they just can't or unable to do anything about it. Such fear can intervene work, school, and personal relationships, and it started to prevent the person from leading their full life, and it started to affect their daily life. Okay, next. Okay, what causes them? Basically, what causes phobia are genetic and environmental factors. Children who have a close relative with an anxiety disorder are at risk of developing a phobia. Distressing events, such as nearly drowning, could bring them to a traumatic situation and then bring them on a phobia. Exposure to confined spaces, extreme heights, and animal or insect bites can all be sources of phobias. So anything around us could be something that maybe a person could fear of. And people with ongoing medical conditions or health concerns also often have phobias, can bring them on phobias. I mean, there's a high incidence of people developing phobias after traumatic brain injuries, substance injuries, and depression are also connected to phobias. And after that will be explained by my friend Lintang Ilyasa.
Okay, kinds of phobia. In this meeting, I will only explain 5. There are social phobia, agoraphobia, acrophobia, nyctophobia, and claustrophobia. Okay, next. First, what is social phobia? Social phobia is also referred to as a social anxiety disorder. It is extreme worry about social situations and it can lead to self-isolation. A social phobia can be so severe that the simplest interactions, such as ordering at the restaurant or answering the telephone, can cause panic. People with social phobia often go out of their way to avoid public situations. Okay, next. What is agoraphobia? Agoraphobia is a fear of place or situations that you cannot escape from. The word itself refers to fear of open space. People with agoraphobia fear being in large crowds or trapped outside the home. They often avoid social situations altogether and stay inside their homes. Many people with agoraphobia fear they may have a panic attack in a place where they cannot escape. Those with chronic health problems may fear they will have a medical emergency in a public area or where no help is available. Okay, next. The third one, okay, acrophobia. What is acrophobia? Acrophobia is defined as a fear of heights. Unlike a specific phobia such as aerophobia, which is the fear of flying, acrophobia can cause you to fear a variety of things related to being far from the ground. Depending on the phobia's severity, you may fear being on the high floor of building as much as simply climbing a ladder. Acrophobia is one of the most common phobias. Approximately 2 until 5% of the general population has acrophobia, with twice as many women affected as men. Okay, next. Nyctophobia. Nyctophobia is an extreme fear of night or darkness that can cause intense symptoms of anxiety and depression. A fear becomes a phobia when it is excessive, irrational, or impacts your day-to-day life. Being afraid of the dark often starts in childhood and is viewed as a normal part of development. Studies focused on this phobia have shown that humans often fear the dark for its lack of any visual stimuli. In other words, people may fear night and darkness because they cannot see what's around them. What is claustrophobia? Claustrophobia is a situational phobia triggered by an irrational and intense fear of height. Claustrophobia can be triggered by things like being locked in a windowless room, being stuck in an elevator, and driving on a congested highway. Claustrophobia is one of the most common phobias too. Besides, before, if you experience claustrophobia, you may feel like you're having a panic attack, although claustrophobia isn't a panic condition. Okay, next will be explained by my friend Firza. Oh, sorry, me. There are also another kinds of phobia such as hemophobia, that fear of blood, dentophobia, fear of dentists, zoophobia, fear of animals, ophidiophobia, fear of snake, hydrophobia, fear of water, arachnophobia, fear of spiders, chromophobia, fear of colors, allurophobia, fear of cats, and entomophobia, fear of insect, and etc. Actually, there's still a lot of kinds of phobia, but I cannot say one by one, so that's it. Okay, next will be explained by my friend.
Okay, thank you for Lintang. So what are the symptoms of phobia? Well, people with phobias often have panic attacks. This can be very frightening and distressing. The symptoms often occur suddenly and without warning, as well as overwhelming feelings of anxiety. A panic attack can cause psychological symptoms such as uh, sweating, trembling, shortness of breath or difficulty breathing, a choking sensation, rapid heartbeat, pain or tightness in the chest, nausea, headaches, and dizziness, dry mouth, and ringing in ears. In severe cases, you may also experience psychological symptoms such as fear of losing control, fear of fainting, feelings of dread or just fear itself, and fear of dying. Okay, next. So what are the treatment of phobia? There are different ways a phobia can be treated, but the most effective form of treatment would be exposure therapy. What is exposure therapy exactly? Exposure therapy is a type of psychotherapy that focuses on changing your response to the object or situation causing you fear. So you are being exposed to the fear for you to face it. Your doctor may recommend certain anxiety-reducing medications that can help you through exposure therapy. Well, these medications aren't exactly a treatment for phobias. They can help make exposure therapy less distressing. Medications that may help reduce uncomfortable feelings of anxiety, fear, and panic include beta blockers and benzodiazepines. Okay, next. Okay, so other treatment options that can help you manage your phobia includes the first one is cognitive behavioral therapy or CBT. CBT combines exposure therapy with other techniques to help you manage your anxiety and keep your thoughts from becoming overwhelming. And second one is general talk therapy with a counselor or psychiatrist. Number three is medication such as beta blockers and sedatives to help reduce anxiety and panic symptoms. The fourth one is relaxation techniques such as deep breathing and yoga. Number five is cycle activity and exercise to manage anxiety. Exercises have proven to have help your stress that can reduce your anxiety. And the last one is mindful breathing, observation, listening, and other mindful strategies to help cope with stress. And it may also be helpful to get enough rest, eat a healthy and balanced diet, avoid caffeine and other substances that can make anxiety worse. That because caffeine triggers your fight or flight response, that means putting you under stress, which makes your anxiety worse. And then the next one is reach out to friends, family, or a support group to connect with other people managing the same issues. Well, you need support system because you are not in this alone. And the last one is face fearful situations head on as often as possible. Well, how do you how do you manage your fears? Well, you have to face it. That means you have to confront it and getting yourself used to it. So, okay, next. Thank you for joining our meeting. If you have any question, you can leave it in the chat section.
Okay, now in this Q&A session, it is limited to one question only. So if you have anything to ask, please leave it in the chat section or turn on your microphone. Okay, Fitri Fatma Dewi. Okay, we have a question from Fitri Fatma Dewi, and the question is, what is the difference between a phobia and a fear? Okay, all right. For the presenters, you can answer when you are ready.
Okay, I will answer the question. Represents my group. Okay, thank you for that. Thank you for the question. So what is the difference between a phobia and fear? As we explained earlier, a phobia is an overwhelming, irrational, persistent fear that usually does not go away that easy. On the other hand, fear and some level of anxiety are actually just a normal and emotional responses to certain things, either a real or a perceived threat. Although it doesn't feel very nice to fear something, For example, you feel a bit scared when you see spider in your room, but that doesn't necessarily mean that you have a spider phobic. Meanwhile, someone who has spider phobia may spend huge amounts of time thinking and worrying about spiders and avoiding places and activities where spiders might be, like the bush or walking outside at night or maybe dark place, and it started consuming and disturbing their daily life. So the point is, phobia is more irrational and it could affect their daily life. And when it comes to fear, it's just an emotional reaction to certain things, and it just easily go away. And that is my answer. Thank you.
Okay, thank you, Aliya, for answering. We now have arrived at the end of the presentation. The presenters now may deliver the conclusion of this presentation.
Okay, thank you. So the conclusion from this presentation is that phobia is not a common fear, but it's tend to be something specific and mostly irrational. We can say that we have phobia when that fear started to consuming our daily life, makes you just worry all the time. If you have a phobia, there are certain treatments that you can do. Overcoming phobias can be very difficult, but with the right treatment, you can learn to manage your fears and lead a productive and fulfilling life. That's all for the conclusion. Thank you.
Okay, okay, all right. Thank you for the material information and the other things that have been delivered by our presenters. So from here, we can draw the conclusion from what was started earlier, namely what the different phobia from the common fear is how phobia makes you irrationally worrying about some specific things. And thank you. That's all from me. I will return it to the house to close the meeting.
Okay, thank you for your time, all and all the presenter. Before I end it, I would like to thank everyone that has attended and participate on this meeting. Okay, now I will end the meeting. Thank you once again. Good afternoon. Wassalamualaikum warahmatullahi wabarakatuh. But before you leave this room, please fill in the attendance on Google Form, and link is in the chat box. I will send you. Okay.